Good evening everyone. Myself Dr. Gourav Pawar from Vasantrao Pawar Medical College and Hospital. I am presenting this paper, Functional Outcome Following the Percutaneous Hebert Screw Fixation in Scaphoid Fracture under the guidance of my guide Dr. Nitin Vaksar and my HOD Dr. Sandeep Pangamani sir. As we know, scaphoid fractures are most common fractures in the scaphoid bone, accounting for 70 to 80% of carpal fractures and 11% of hand fractures. Out of considering scaphoid, 70% is a waist fracture, which is most common. Proximal fold fractures are around 20% and distal fold fractures are around 10%. The aim of the study was to study the functional outcome of percutaneous screw fixation of scaphoid fracture using Hebert screw. This was the prospective observational study which was carried out among the 23 patients in our hospital. My inclusion criteria was displaced fracture of waist with an offset less than 1 mm or gap of less than 2 mm in 2 fragments, undisplaced fracture of scaphoid, oblique fracture of scaphoid, displaced fracture which can be reduced by close reduction, comminuted fracture of scaphoid and scaphoid fracture which are less than 4 weeks. Exclusion criteria in this study was the fracture of distal pole of scaphoid, non-union in chronic scaphoid fracture and fracture dislocation of carpal bones. This is a preoperative X-ray showing the scaphoid waist fracture. We have taken PA view, lateral view and scaphoid waist scaphoid view. We actually first locate the entry point for our screw by using the fluoroscopy image by making it on AP and marking it on the AP and lateral radiographs. This is how we mark. Then the guide wire is inserted to that exact point and screw is placed inside. This is a post-operative X-ray, and this is a follow-up X-ray of 6 months showing a union at fracture site and a good range of motion. In this my study, 92% patient healed after an index procedure. Out of 8% patient needed one more procedure. This study was compared by the study which was done by Patillo DP and et al. In 2010. They carried out study on a 32 patient where 89% patient were healed successfully. Another comparison was done with the study of Parajoli NP and et al., which was assessing the radiological findings. In my study, I had 90% patient had a good radiological findings of healing and 10% had an average. As in Parajoli NP et al. Study, they had 93% good radiological findings. Now the functional outcome was compared and studied with the use of dash score. In my study, I got an 39% patient had an excellent outcome, 59% patient had a good outcome, and 5% patient had a satisfactory outcome. As compared to the Parajoli NP, they had excellent outcome of 60% patient, good outcome of 33% patient, and a poor outcome of 6.7% patient. So result of my study was total 23 patients were underwent with the percutaneous fixation of scaphoid. The mean age was 31 years, majority being the males and the majority be sports injury. It was seen that 92% patient healed successfully after an index procedure. Common complication which was noted was non-union, which was 6%, 3% decreased grip, 2% pinch strength. Majority 90% showed good results on radiological finding after 6 months of operation. The average dash score in this patient was 8.1. My conclusion of my study is, this study suggests that percutaneous Hebert fixation of displaced scaphoid fracture provides satisfactory clinical and radiological outcome. The technique allows more rapid return to work and the sports activity than the conservative treatment. More of we can say by fixing the scaphoid with the percutaneous screw, we can early mobilize the patient with the less complication rate. There can be better range of motion and better pinch strength. The disadvantage of long period of cast immobilization can be avoided. These are the references which I used for my study. Thank you.